Good afternoon. My name is Roberta Alessandrini from the Physicians Association for Nutrition International. Today, I will talk about the nutritional aspects of plant-based meat products. The presentation will cover some research findings on the topic, which will be relevant for both the industry and for consumers. Before starting, let me introduce the Physicians Association for Nutrition, or PAN. PAN was established in 2018 as the International Medical Network implementing nutrition in healthcare. We have a strong focus on plant-based nutrition as evidence shows that diets based mostly on plants are healthy for people and for the planet. So let's start with definitions. What is plant-based meat? These are food products resembling the taste, the appearance, and the texture of widely consumed meat products, such as sausages and burgers. These are easy and convenient swaps for those wanting to reduce their meat intake, such as flexitarians. Before talking about the nutritional aspects of these products, it's good to keep in mind that these products have gained popularity also because meat is very unsustainable. The diagram shows that the production of plant-based foods such as broccoli, beans, or plant-based meat burgers emit only a small fractions of the emissions linked to animal-based products such as beef burgers, cheese, or pork sausages. So the situation is similar for other indicators of environmental impact, such as water and land use, eutrophication, and biodiversity loss. So in general, plant-based products are more sustainable than meat products. But in spite of all of their more beneficial footprint, plant-based meat products have been the subject of much criticism. Here you can see the headlines from some international newspapers questioning the healthiness of these products, particularly when compared to conventional meat. In general, the criticism to these products can be grouped as follows. So we often hear that these products are less healthy than conventional meat. We hear that these products are ultra processed and therefore we should be avoiding consuming these on these grounds. And then we hear that these products lack key micronutrients commonly found in animal-based products. And then consuming these products would lead us to have diets deficient in these micronutrients. So let's first address the first criticism. Plant-based meat is less healthy than conventional meat. Is plant-based meat less healthy than conventional meat? So to answer to this question, let's see how food healthiness can be measured in practice. Food healthiness can be measured by looking at the occurrence of specific health outcomes after consuming a food or a particular dietary pattern. Usually, the study designs used for this assessment are observational and intervention studies, such as randomized controlled trials. However, these studies require lots of time, lots of money, and can be prone to bias. Another quicker and cheaper way of saying how healthy is a food is to consider its nutrient profile. I will talk about nutrient profiling over the next couple of slides. But for the moment, let's focus on this question. How healthy are people consuming plant-based alternatives? So long-term studies on vegetarians showed that plant-based diets are linked to a reduced risk of quite common diseases, such as ischemic heart disease and cancer. However, these studies don't really tell us if the consumption of plant-based meat is linked to more positive or negative health outcomes. Basically, it's impossible to single out the health effects of plant-based meat when considering an overall diet. As I said, there is another way of considering the healthiness of a food or a diet. This consists of considering its nutrient profile. Nutrient profile basically gives an idea about how healthy is a food in general. It gives us an overall idea of the healthiness of that food. It might sound like a scary and difficult to understand word, but basically, a nutrient profiling model or system considers the balance of positive and negative nutrients for non communicable disease prevention. So, negative nutrients are saturated fat, salt, or total fat, and positive nutrients are dietary fiber or dietary protein or fruit and vegetables. So the Nutri-Score or the UK traffic light system or the Health Star rating are front of pack nutrient labels that are based on nutrient profiling systems. So to understand if plant-based meat are better or worse than meat from a nutritional standpoint, it's important to make the comparison between the two. I'm highlighting this because a lot of studies available in the literature do not make this direct comparison. And I personally believe that it's a very important comparison to make if we want to address the common criticism around these products. So together, let me show you the results of a study I led with some colleagues at Queen Mary University of London in 2021. So we considered more than 400 products available in supermarkets. Half of these products were plant-based meat, and the other half of these products were the equivalent meat products. So plant-based meat sausages, burgers, meats, and meat sausages, meats, burgers, and so on. We extracted the nutrient information from the labels of these products, and we analyzed the nutrient profile of these products. So our analysis was very simple. In practice, we looked at the percentage of product with at least one red label for one of the bad nutrients, so total fat, saturated fat, or salt, according to the UK front of pack nutrient criteria. And surprisingly, we found out that only 20% of plant based meat products had at least one red label for one of the unhealthy nutrients, whereas 40% of animal meat products had at least one red. And we also analyzed our data with by using another nutrient profiling model, and we had basically similar results. Plant-based meat was healthier compared to their meat equivalents. And finding from another large investigation, whose result came out this year, basically said the same. That plant-based meat products have a more favorable nutrient profile compared to meat products. The only concern in these products in our UK investigation was salt. We found that these products were higher in salt compared to meat. But the recent investigation that I told you about, the Australian one, found the opposite, found that plant-based meat products had less salt compared to the equivalent meat products. In other countries, the situation can be also different. For example, in Sweden, the salt levels of meat products and plant-based meat products were similar. So our investigation showed this very interesting finding that there was a wide variation of nutrient content within each product category. So here for salt, we can see that one product is much saltier than another. And we found exactly the same in all categories. So here you can see this alternative breaded chicken products, and one has 1.5 grams of salt per 100 gram, and this other product with the white packaging has only zero point 0.4 grams of salt per 100 grams. And the products are similar. They're alternative chicken cutlets or schnitzels. And yeah, what can we tell consumers here? We can tell them to choose the products with the lower salt content, because it's for salt, the lower the better. We need to bear in mind that for a human being, the daily maximum recommended intake of salt is 5 grams per day, and this is very this is a very small amount of salt, because we need to consider that a lot of manufactured products such as bread or breakfast cereals, biscuits, and cheese, they have a lot of salt. And yeah, one slice of bread can have 1 gram of salt, and if we eat 2 slices of bread, we've eaten up half of our recommended salt intake. So for consumers, I would say that products with less salt are better for health. And this other last point of this slide says what is the healthiest plant-based meat product? Because I've included this, I always get asked this question. So in our data set, it emerged that plant-based meat chunks were the healthiest product in our data set, because they had no salt and fat. But preparing these foods, these products require some basic cooking skills and time, and so the convenience factor is lost. And what are the takeaway messages from the industry? So as a nutritionist, I would say that if you can, it's good to reformulate these products to have a reduced amount of unhealthy nutrients and salt in particular, because this could improve the population health, but also because this could make plant-based meat products more suitable for specific settings that have nutrient standards. For example, I always have conversation with dietitians and nutritionists working in school canteens, and they often say that they cannot they cannot include these products, plant-based meat products, in the menu, because sometimes they have an excessive salt content. So it would be good to see healthier products available on the market. Okay, let's now focus on the ultra processing issue. I know you've heard this word many times, and let's try to understand where this word comes from. So this word comes from the NOVA classification, which is a food classification system developed by nutritionists. And it groups foods according to the level of processing. So the classification includes 4 categories of foods. So the first category includes minimally processed foods such as vegetables, legumes, fruits, nuts, and so on. And then we have the fat, sugar, salt group, and then we have the processed food group, which includes canned fruit and vegetables, bread, cheese, whole cut, cured meats. And then we have the ultra-processed food group, which is defined as follows. So ultra-processed food are formulations of ingredients of exclusive industrial use that include ingredients never or rarely used in domestic kitchens, such as additives and preservatives. So these foods include all the bad guys. So chocolates, ice creams, chips, sugary drinks, and also plant-based meats. But let's look more into this. So why this word has become synonym with unhealthy? because it has been found that diets high in ultra processed food are associated with an increased risk of obesity, type 2 diabetes, and cardiovascular disease. So basically, eating lots of chocolates, ice creams, and unhealthy food increases the risk of disease. Whereas, in contrast, minimally processed foods intake, so vegetables and nuts and legumes. So these foods are not linked. So they're linked to positive health outcomes. They have these foods have a protective role. And there is a but here, because I want to say that these studies always show an association. So ultra processed food consumption is associated with adverse health outcomes, but in science, association doesn't mean causation, and it's important to keep this in mind. Moreover, some factors might explain why people eating a lot of ultra processed food have a poorer health, because they might move less, they might eat more calories than needed. They have a variety of environmental factors affecting their food choices. So these factors might have an impact on these associations. So now let's go back to our question: is plant-based meat ultra-processed? So to answer to this question, I want to show you the results of a study I co-authored with some Australian researchers. In the study, we classified most of plant-based meat products available on the Australian market, and we also classified according to the NOVA classification, but we also classified meat products. And it emerged that most plant-based meat products were ultra-processed, but also their corresponding meat products in most cases were also ultra processed, but we couldn't really find a clear pattern, because for example in meat with pastry 100% of meat and plant-based meat products were classified as ultra processed, but for example when we considered other categories such as burgers, we had a lower percentage of ultra processed foods in the plant based meat categories. It was confusing, and we had problems classifying these foods. And it turned out that we were not the only research groups who had problems using the NOVA classification. We had a high level of disagreement between us in saying, when we basically wanted to classify these foods. So, for example, what was ultra processed for me was processed for another nutrition researcher. And as I said, this happens also in other research groups. And this has been reported also in the literature. There is a very interesting study showing this. And this happens because the NOVA classification often relies on qualitative parameters. So qualitative parameters are very subjective, and it's difficult to give an objective assessment and say, okay, this food is, ultra processed or processed. Let me give you a practical example here. So, packaged wholemeal bread is considered by most nutritionists as ultra processed food, but whereas artisan white bread is not considered ultra processed, but it's considered a little bit better. It's considered as processed. So, but we know that wholemeal bread, although it comes in a package and maybe has one additive, has a lot of fiber and whole grains, which are amazing for health. And also, we don't know if artisan bread have more salt, because we know that usually products which are sold without a label tend to have a more unfavorable nutrient profile. So, as I said, this classification is very qualitative, and it often relies on the concept of food naturalness. Another point that I want to mention is that specific evidence on the negative health impacts as plant-based meat as ultra-processed foods uh, are not available in the literature, and we cannot really say much about it. We cannot say that plant-based meat is bad because it's ultra-processed, because there is no evidence showing this. On the other hand, we can say that consuming red and processed meat is clearly and strongly linked with an increased risk of developing colorectal cancer. So we can start by reducing the intake of these foods if we want to improve the health of our health or the health of our population. Also, the ultra process and the NOVA classification, it's just a blanket definition in it, which doesn't really takes into account very much reformulation or the fact that some manufactured products can be healthier than other. So, for example, here, as I said before, one product can have much less salt than another within the same category. So again, I said more than once that we need more evidence, but we don't need more evidence saying grouping. We don't need more studies grouping plant-based foods with donuts, tacos, pizzas, chocolates, and ice creams, with all these bad foods, just to show that the consumption of these foods is linked to poor health outcomes. We need studies that clearly show that plant-based meat alone, that considering plant-based meat in isolation, to understand more about the healthiness of these foods and the impacts on health on these foods. Okay, now let's focus on the question on micronutrients. So we've heard many times that meat contains a lot of important micronutrients, such as vitamin B12, zinc, and iron. And this is true. So plant-based foods, all plant-based foods or plants are not a sufficient source of vitamin B12, which is an essential vitamin for the correct functioning of our nervous system and for red blood cell formation. It does many important things in our body, vitamin B12. Unfortunately, plant-based foods do not have this vitamin. We also know that zinc and iron are two important minerals which are highly bioavailable in meat. They can also be found in plant-based meat, but they are less bioavailable in plant-based foods. The good news is that plant-based meat product can be fortified with these micronutrients, but when looking on a supermarket shelf, you will often realize that a very small percentage of these products are fortified with these key micronutrients in plant-based diets. And so from my perspective, fortification could be a very useful strategy could be a way of improving the nutritional quality of these products. And the food industry has a very important role in this area. Although I have to say that more research is needed to understand if the micronutrients added to plant-based foods can effectively be absorbed and utilized by the human body. There is, again, not much evidence in this field. And this is also because these foods are so new that, we started consuming widely these foods only in the recent years. And we urgently need evidence showing this, showing more the health aspects of plant-based products. So to conclude, I showed you that plant-based products are healthier than conventional meat when considering the nutrients to limit or increase for the prevention of non-communicable disease. We talked about the ultra-processing issue, and most of plant-based meat products belong to the ultra-processed food category, but this word and this classification is quite problematic, and it's not aligning with what we've been knowing for a long time about what is considered to be a healthy food. reformulation, especially for salt, if we consider plant-based meat products, and fortification, vitamin B12, it's a very important one, are two strategies which can be used to improve products' healthiness. And again, I want to conclude with an invitation to researchers who might be listening to urgently carry out more research to understand the long-term impacts of plant-based meat alternatives on health. So everything that I've been saying today is summarized in our position paper on plant-based meat. So at PAN, we realized that, we provided lots of very useful educational material for doctors, nutritionists, dietitians, and other healthcare professionals, because we want to empower these professionals with knowledge about nutrition, with sustainable nutrition. But we realized that we needed to have a position on plant-based meat, and we recently released this paper which basically summarizes that all that I've said today, and you can scan the QR code and download the paper and read it. It's very short and easy to read. Okay, thank you very much for inviting me to this summit. It's a pleasure to be here with you today. And if you want to get in touch with us, please do follow us on our social media platforms, Facebook, Instagram, and LinkedIn. We publish on a daily basis a lot of easy to understand and relevant content for healthcare professionals, but also for the general public. Thank you very much. Have a good evening.